For many years, Ifakara Health Institute has existed to improve health and well-being of people. This is Kilombero Valley, Morogoro region, Tanzania, where Ifakara Health Institute was born in 1956. A visit to Ifakara town by Professor Rudolf Gegi, a scientist from Swiss Tropical Institute in Basel in 1949, marked the beginning of over 60-year history of the institute. 7 years later, he opened the Swiss Tropical Institute Field Laboratory there, which is known as Ifakara Health Institute today. The name Ifakara refers to a place you go to die, a reflection of the historically high burden of disease in the area before major control efforts started. After the 1961 independence in Tanzania, Swiss Tropical Institute Field Laboratory, also known as STIFIL, played a central role in training medical officers who could serve the country after independence. In the late 1960s and early 1970s, Tanzania adopted the nationalization policy which championed transferring of public institutions into the hands of Tanzanians. In 1990, the policy set the stage for the integration of STIFIL into a government agency, NIMRI, that is, the National Institute for Medical Research. Just like a baby, STIFIL has grown over the years to the Ifakara Health Institute of today. From 1991 to 2008, STIFIL was renamed and rebranded to different names. Ifakara Center in 1991, Ifakara Health Research and Development Center in 1996, and Ifakara Health Institute in 2008. Currently, Ifakara Health Institute's headquarters is in Dar es Salaam, with other branches located in Bagamoyo and Ifakara. Over the years, Ifakara has operated under the leadership of a director, with the institute making history in 1993 when Dr. Andrew Kitua was appointed as the first Tanzanian science director. His immediate successors, Dr. Hassan Mshinda and Dr. Salim Abdullah, built strong teams that took the Institute to a high level of excellence, extending the operations of the Institute to other regions. Carrying on and following the footsteps of his predecessors is Dr. Honorati Masanja, the sitting Chief Executive Director who was appointed in 2016. Ifakara Health Institute has accumulated over 60-year experience of working with the Tanzanian government, local stakeholders, and funding partners from different parts of the world. Our engagements with these parties have been strategic and of paramount importance. Our management system has been certified as ISO 9001-2015 compliant, which is granted to organizations with management systems with a proven strong customer focus, good motivation and implication of top management, good process approach, and continual improvement. Ifakara is best known for its work on malaria, while also focusing on all health challenges identified as important by the Tanzanian government and the community at large. The Institute's scientists work on a wide range of diseases, ensuring that research translates into tangible health outcomes. The Environmental Health and Ecological Sciences Department focuses on the ecology and transmission of infectious diseases through developing and testing of surveillance and control measures, which include mosquito ecology and control, water, sanitation and hygiene research.
We have the largest infrastructure for conducting entomological work, probably in the region or in Africa. This includes testing of different products, vector control products, that is happening at our facilities.
In recent years, major activities have included research of ecology of disease-transmitting mosquitoes with special focus on malaria, and now expanding to other mosquito-borne diseases. The Interventions and Clinical Trials Department conducts trials on drugs, diagnostics, and vaccines for tuberculosis, HIV, malaria, and other diseases including respiratory pathogens, zoonotic diseases, arboviruses, and various emerging and re-emerging infections.
Ifakara Health Institute is one of the institutions that participated in the evaluation of the RTSS vaccine that has been approved by WHO for rollout across Africa. So we conducted the early stage studies to evaluate whether the vaccine was efficacious but also was safe. And we were able to demonstrate that, and then it went for further stages which were done elsewhere.
Health Systems Impact Evaluation and Policy Department conducts multidisciplinary studies of health systems performance and community health programs, including service delivery, quality, effectiveness and cost-effectiveness, equity, health financing, human resources for health, governance, and accountability. It also monitors and evaluates pilot initiatives, national, community programs, and changes in population health status. The department also evaluates impact and outcome of public and community-based interventions for improved health and well-being, as well as behavior change and their relevant determinants. The Training and Capacity Building Department supports our on-site training programs located at the Bagamoyo branch. The center coordinates all training and capacity building activities and skill transfer short courses in different scientific disciplines based on our key research areas. Training activities also include co-supervision of masters, doctoral, and postdoctoral fellows from partner universities. The Training and Capacity Building Department also offers a Master's in Public Health Research program designed for young university graduates who are interested in becoming public health researchers. Modules are suited for a complete master's degree but can also be taken in parts as a foundation for PhD candidates. The program is delivered within the mandate of the Nelson Mandela African Institution for Science and Technology, Arusha, in line with the Memorandum of Understanding between Ifakara and the Nelson Mandela African Institution for Science and Technology. Ifakara has 2 biosafety level 2 laboratories in Bagamoyo and Ifakara, which are well equipped with basic and state-of-the-art equipment. The labs are ISO 15189-2012 accredited for medical laboratory testing in clinical chemistry, hematology, and parasitology, awarded by the Southern African Development Community Accreditation Services. The labs allow both conventional and state-of-the-art analysis. These labs were established to support laboratory-based research, including clinical trials and training services. The labs are staffed with highly skilled and experienced technical and support personnel. Research on various diseases including malaria, tuberculosis, non-communicable diseases like diabetes and other bacterial infections are conducted in these labs.
The evaluation of bed nets using a social marketing approach. This was done back in the early mid-90s, and the result of these studies have informed the way nets are rolled out in Tanzania, but also informed the need for establishing a factory in Tanzania, which, as we know, we have the A to Z in Arusha, which provides or produces more than 10 million nets a year. And these are distributed all over Africa. And this factory contributes in many ways, in jobs, but also in revenue to the country.
Today, the Institute is acknowledged to be a major contributor of health policies, research, and interventions for malaria, as well as other diseases such as HIV, TB, and non-communicable diseases. The list of Ifakara's achievements in the health sector continues. Ifakara is on an endless mission to find a beam of light against any darkness that can threaten the health and well-being of people. Ifakara remains strongly committed to its mission of improving health and well-being of people. Ifakara Health Institute went through a hard-going journey, but still overcame all major challenges. It turned the term "a place where you go to die" into a place of hope.